Hi, my name is Victoria Lulich, and today I'll be presenting a lightning oral abstract on the characteristics and demographics of HIV-positive patients tested in an urban academic emergency department. Thank you to all the students who helped out with this project, and a special thanks to Drs. Stacey Rhodes, Evrim Oral, and Lisa Moreno-Walton. For HIV-positive patients, early enrollment and retention in care are essential to achieving an undetectable viral load and to reducing viral transmission within a community. Yet nearly half of HIV-infected individuals are not engaged in care. The overall aim of this study was to better understand the characteristics and care patterns of the population of HIV-positive patients accessing care in acute emergency settings, specifically by looking at the associations between patient characteristics, linkage to care, and overall mortality. To do this, we performed a retrospective chart review of 851 HIV-positive patients screened at an urban academic emergency department within a high prevalence area from March 15, 2013 to December 26, 2018. Data was collected using predetermined search terms for each variable, and descriptive statistics were used to estimate the distributional properties of all variables. The demographic variables are as listed, and some of the outcome variables we looked at include mortality, which is evaluated using multivariable Firth's logistic regression modeling, linkage to care, and time until HIV medical visit in days, which was evaluated using a multivariable Poisson regression model adjusted for over-dispersion. In our sample, patients' ages ranged from 18 to 75, with approximately 55% of participants between the age of 20 and 40 years. The majority of the sample was identified as male in their medical record, with 51.3% of those men reporting female sexual partners only, compared to the 36.3% who reported male sexual partners only. The remaining reported both or neither, or did not disclose. This figure illustrates the racial distribution of patients within the sample, 74.3% of which were African American and 18.3% of which were white. 20% of study participants had a history of IV drug use or homelessness, with rates higher among those who had a known positive HIV diagnosis prior to screening in the emergency department. And important to note, 43% of patients had progressed to a stage 3 infection by the time of their diagnosis, meaning they had a CD4 count less than 200. Time to HIV medical visit and successful linkage to care were two outcome variables we looked at. According to CDC guidelines, an individual is considered linked to care if they are seen and evaluated by an HIV provider or infectious disease physician within 30 days of their positive HIV test result. The average time between screening and receipt of HIV medical care in our study was 93 days. Transgender patients had longer periods until HIV medical visit with respect to females, and longer time until HIV medical visit was also significantly associated with homelessness and IV drug use. In contrast, patient history of 2 or more sexually transmitted infections was associated with a shorter period before HIV medical visit. Time until HIV medical visit was not significantly associated with age, race, alcohol use, tobacco use, or insurance status. In our sample following screening, 48.5% of new HIV cases were linked to care within 30 days, and 20.8% of known HIV positive cases were re-engaged in care when they had not previously been in care. Mortality was the third outcome variable we looked at, and 35 patients in our sample died during the study period. Logistic regression analysis indicated that males were 0.36 times less likely to die compared to females, and that patients with a history of IV drug use were 2.5 times more likely to die within the study period compared to those with no prior history. None of the patients who were screened during the acute infective phase or those who received an HIV diagnosis prior to seroconversion died during the study period. In conclusion, identifying the barriers to HIV care retention and facilitating the linkage maximizes the proportion of the HIV-positive population receiving care. Therefore, it's one of the key issues facing providers and health professionals within the field, especially in high prevalence areas. In our sample, 43% of patients screened for HIV in an urban emergency department setting had progressed to AIDS by the time of their HIV diagnosis, with an overall average of 93 days between screening and the HIV medical visit. Delayed linkage and receipt of HIV care was significant among transgender patients and patients with a history of IV drug use or homelessness. And this was further reinforced by regression analysis of patient mortality. These results should inform future management of HIV-positive patients in high prevalence areas to improve care engagement and health outcomes. Thank you for listening, and I hope you enjoyed the presentation.